more than 40% of the eligible population, up from 33% just 2 weeks ago. As of today, nearly 49% of eligible Hoosiers are vaccinated or have made an appointment to receive a vaccine. It's incredibly exciting to see those numbers increase. It's also exciting to know that by the end of the day, nearly 361,000 additional Hoosiers could be eligible for this life-saving vaccine if the ACIP and CDC approve the use of the Pfizer vaccine in children ages 12 to 15, as we expect will happen. We have made incredible progress as a state in our fight against this pandemic, but we still have a journey ahead of us, and we don't want to give up any ground. As of today, Indiana has reported almost 1,900 variant cases, up from 1,100 2 weeks ago. These include nearly 1,500 cases of the B.1.1.7 variant, which originated in the United Kingdom and is the dominant variant that we are seeing here in Indiana. 15 cases of the B.1351 variant, which originated in South Africa, and 120 cases of the P.1 variant that originated in Brazil. We have also had 250 cases involving the variants that were first detected in California. All of these variants have increased significantly over the past 2 weeks, and they now represent almost 42% of the samples that we have sequenced since the beginning of our starting to sequence. Our statewide positivity rate has also increased to 5.3%. This is a reflection of the variants, which are much more infectious, and a decline in the testing recently. When you test people who are sick, you expect to see more positives. We continue to provide counties with their color-coded maps so that we can monitor changes in COVID activity easily. You can see that the number of orange and yellow counties has changed again, which reflects a shift in COVID activity in some areas of the state. Our 2-score county map shows 6 counties in orange, down from 7 2 weeks ago, and 41 in blue, down from 52 on April the 28th. That leaves 45 in yellow. Our advisory map shows 10 counties in orange, which remains consistent, and 34 in blue, down from 37 2 weeks ago. That leaves 48 in yellow. When cases increase, we also see an uptick in hospitalizations due to COVID. The number of people currently hospitalized with COVID continues to hover around 900. It is still significantly lower than the nearly 3,500 Hoosiers that were hospitalized in late November, but it remains much higher than we were here in late March. The number of people being admitted each day due to COVID has doubled to more than 100 since March. As more COVID restrictions, these numbers warrant our continued attention. We want every Hoosier to be safe from COVID. That requires making the best use of mitigation strategies such as wearing a mask, regardless of whether it's required, because we know that masks, social distancing, and hand washing work. It also reinforces the need to increase our vaccination numbers statewide. You can see on this zip code level map that we have areas of the state with high uptake of vaccine, which is represented here with the darker blue and the lighter blue hues. But we also have many areas of those in red or orange where the vaccine uptake is low. We continue to work with community partners in those areas to bring our mobile clinics to those locations and ensure that vaccine is accessible to all. But as someone said to me recently, this isn't as easy as a field of dreams where you build it and they will come. We have largely reached the population that was eager to be first in line to be vaccinated. Now we're working on those who have been on the fence or who remain hesitant, and we're doing that one shot at a time. Overcoming vaccine hesitancy requires all of us working together to remove barriers, to debunk myths, and to focus on all of the benefits of getting vaccinated against COVID. For example, being fully immunized means you're protected from a disease that has claimed more than 13,000 lives here in Indiana. It means you can go out to dinner without worrying about social distancing and masks. It means your fully vaccinated student athlete won't have to miss practice or games or school if he or she is listed as a close contact to a positive case, so long as your child does not develop symptoms. It means that if you work in a long-term care facility, you do not have to undergo routine COVID testing if you're fully immunized. Currently, staff are subject to testing to up to twice a week, depending on the level of transmission in the county in which the facility is located. When we look at our data, Indiana ranks between 38th and 40th, the lower half, for hospitalizations, meaning higher hospitalization rates, higher positivity rates, and higher cases per capita. and the percentage of that population that is fully vaccinated. But we rank 19th in the percentage of new deaths, which I firmly believe reflects our early emphasis on vaccinating our most vulnerable Hoosiers. Vaccines work, and they represent a return to the normalcy that we all crave. I continue to encourage every Hoosier to take advantage of the more than 700 locations around the state that are now offering free COVID-19 vaccines. Remember, no appointments are necessary. You can walk up at almost every site. Adding the ability to simply walk up without registering has helped reduce wait times for vaccination appointments and has increased traffic at mass vaccination sites like the Indianapolis Motor Speedway, particularly among our communities of color. In allowing walk-ins, we know that there will be trade-offs. In this case, that means accepting a certain level of vaccine wastage for as long as the vaccines are packaged in multi-dose vials. We know that vaccine wastage may increase as the vaccine rollout continues because more providers, including smaller provider sites, are now receiving vaccine, because vial sizes for some vaccines have increased, like the Moderna. About a fourth of our doses we receive are now in 14-dose vials. And the vaccine vials may be opened without using every single dose. We've communicated to providers that while we want them to minimize wastage, they should not do so at the expense of getting a shot in the arm of someone who wants to be vaccinated. Providers should not miss any opportunity to vaccinate every eligible person who comes to a vaccination site, even if it means opening a multi-dose vial to administer that vaccine without having enough other people on hand to receive the remaining doses in that vial. Providers can minimize wastage in these instances by offering to vaccinate family members or friends who accompany patients to their medical visits, and by maintaining wait lists or even contacting people whose appointments are scheduled a few days later to see if they want to be moved up. I would much rather us administer that shot and have a couple of leftover doses than to turn that person away because we don't have takers for the remaining doses in a vial. I'm confident that our providers can be creative so that we can maximize every dose possible. Finally, I want to let you know about an update that is coming soon to our dashboard. As we begin vaccinating 12 to 15-year-olds, we want to also include information about the number of cases that we're seeing of multi-system inflammatory syndrome in children, or MIS-C. This is a condition in which different parts of the body can become inflamed, including the heart, lungs, kidneys, brains, and other organs. MIS-C is really related to this hyperimmune inflammation that results usually after exposure to COVID-19. We know that many children developing this condition had the virus that causes COVID-19 or had been around someone with COVID. To date, Indiana has had 89 cases in people under the age of 20. Nearly 2/3 of those cases have occurred in males. Thankfully, all of these individuals have been discharged from the hospital. We will add this to our dashboard in the coming days as yet another way to measure the effectiveness of vaccines in our younger populations. And now Dr. Weaver will give us additional vaccine updates.
Thank you, Dr. Box. Today marks the next step in our efforts to protect more Hoosiers against COVID-19. The CDC's Advisory Committee on Immunization Practices is meeting right now to review the FDA's extension of the emergency use authorization for the Pfizer vaccine that would make it available to children ages 12 to 15. We expect the CDC to sign off on this later today. Once that happens, we will update our website at rshot.in.gov so that as of 8 a.m. tomorrow, parents can register their child who is age 12 or older for an appointment. You also will be able to walk into a Pfizer site with a parent or guardian without an appointment. I am excited for this next step, both as a physician and as a parent. As a doctor, I know that the more people we protect from COVID, the fewer cases we will see, and our hospitalizations and deaths will decline. As a parent, I want my oldest daughter, who has been so worried for this past year, to finally have peace of mind. We hear daily about the sacrifices that families have made to protect their loved ones who have medical conditions that put them at greater risk of severe illness or death from COVID. In some cases, that has meant healthy children have remained virtual learners for more than a year to protect a high-risk sibling. In others, it has meant giving up cherished extracurricular activities such as athletics or show choir. Expanding the vaccine to younger Hoosiers will help our children start getting back to the activities they love. It will help them to have a summer that is focused on quality time and not quarantine. It also will help ensure that the next school year looks much different for our students, teachers, and staff. We all want that normalcy, and the best way to get there is to increase the number of people who are fully vaccinated. As you can see, our older Hoosiers are still leading the way in the percentage of the population vaccinated. 76% of Hoosiers age 80 and older have received or scheduled a vaccine. 80% of those ages 70 to 79 have done so. And 70% of those ages 60 to 69 have scheduled or received a vaccine. We have seen a slight increase in vaccine uptake among younger groups, but we still have a lot of work to do. So far, 53% of Hoosiers age 50 to 59 have scheduled a vaccine, and 42% of people in their 40s have done so. We have seen the percentage of those in their 30s who are getting vaccinated increase to 36%. We now have 30% of people in their 20s signed up or vaccinated, and 27% of those ages 16 to 19 have done so. In total, nearly 49% of eligible Hoosiers are vaccinated, in the process of being vaccinated, or have made an appointment. We have plenty of vaccine available to us, but we are ordering responsibly so that we are not hoarding doses or increasing our risk of having vaccine go unused or expire. As you are aware, the federal government has begun reallocating doses of vaccines from states where demand has waned to areas with higher need. To date, Indiana has pulled down 82% of its available vaccine, but many of our vaccine providers have not placed new orders because they have adequate supplies on hand as appointments have declined. Last week, we saw a roughly 19% decrease in overall doses administered from the previous week. But second doses uptake remain high, with about 92% of people getting their second dose. Our 211 system continues to reach out to people who are late for their second dose to help those individuals get scheduled. When we are deciding how many doses to order each week, we look at scheduled appointments and add a percentage to account for walk-ins. We also compare those numbers to existing inventory, which we ask providers to give us each week. That helps us to know whether a certain vaccine is running low in an area so we can replenish supplies when needed. This week, we also have looked at availability of Pfizer vaccine across the state in anticipation of the CDC's approval of the vaccine's use for 12 to 15-year-olds. Our goal is to ensure that Pfizer is available at every local health department. To achieve this goal, we are sending Pfizer vaccine to local health departments in 30 counties that do not have any Pfizer providers. Those doses will arrive on Thursday. We also are sending the same number, we're also sending vaccine Pfizer to the other local health departments that will arrive on Monday, and we'll be ensuring that each of our mobile units carry Pfizer. Having this vaccine available will ensure that counties and local health departments can administer vaccine to all ages so that no vaccination opportunity is missed. As we work to promote awareness of the efficacy of vaccine, we continue to have our data team examine our data. One of the most recent efforts has been to calculate the odds of getting COVID with and without the vaccine. Our findings show that unvaccinated Hoosiers make up 99.3% of COVID-19 cases in Indiana. If you are not vaccinated, your odds of getting COVID are 1 in 29, while your odds of being hospitalized with COVID are approximately 1 in 525. And if you are fully immunized, your odds of being hospitalized decrease to 1 in 50,394. Please don't gamble with your health or with the health of your loved ones. We have more than 700 vaccination locations around the state that are available for walk-ins. Many sites offer more than one type of vaccine for Hoosiers who have a preference of one manufacturer over the other, and we continue to put mobile clinics in communities where the need exists. None of these efforts would be possible without the incredible partnerships from across the state. But ultimately, how quickly we are able to put this pandemic behind us will depend on every eligible Hoosier making the choice to get protected from COVID-19.
Now we'll go to Jenny for questions.
Our first question today is from Eric Berman of WIBC.
Hey, Eric.
There's the button. You'd think I'd know this by now. Good afternoon. I wanted to ask both of you about Senate Enrolled Act 5, which now is the law of the state. Marion County has already adjusted and reapproved the restrictions that were in place. How much of a concern is, I know your preference was that law not take effect. How much of a concern is it in terms of infection rates going forward in the other counties that did have those orders?
Well, I think it's, I I think it shows that Marion County, alike almost all of our other counties, were working very closely with their local elected officials to make the decisions that were best for their community, because they could easily transition over and keep the same mitigation measures implemented in their county. What Dr. Weaver and I experienced over this past 14 months was hundreds of phone calls with individuals where the hospitals, the local public health, and elected officials were all engaged in the conversation. And I think that's the emphasis that needs to continue, is looking at the data specific to their community, their county, their zip codes, and then making decisions as a group for what's best for their community.
Our next question is from Steve at KPC Media.
Good afternoon, Dr. Box, Dr. Weaver. One quick question, or I guess two quick questions here. You mentioned getting Pfizer vaccine to counties that currently don't have it, which would be 3 of the 4 counties up here. So I didn't know, is that going out to every county that currently doesn't have it, or just a select 30? And then my other question is looking at the number of first-timers coming in from vaccines. We've fallen from, around 56,000 people back when it was opened up to everyone to now under 10,000 people coming in for their first shots per day. So what's being done, to try to get more people in the door? I know it was mentioned that the people who really wanted it have probably already come and gotten it. So what are some ongoing efforts to try to get it to those other people who are still on the fence?
So to answer your first question, the 30 are the 30 counties that we don't currently have Pfizer locations at. So that's why we are making sure that we get those Pfizer out to those 30 counties tomorrow by sending them directly to the local health departments. And then the rest of the local health departments will receive it by Monday because they already have Pfizer locations in their county. So we will, as of effective tomorrow, have Pfizer in every county across the state, which is very exciting. We have seen a significant decrease in the number of new people going out to get vaccinated. Hopefully that'll change tomorrow when we have a bunch of 12 and 15-year-olds come out to get vaccinated. And right now, Dr. Box and I's approach is it's one person at a time if that's what we have to do. If we show up to do a clinic and 5 people showed up, then that is successful. We'll take every single dose. We knew we would reach this point. We knew we'd reach a point where it was slow and steady. And I wouldn't necessarily assume all those people are hesitant. Maybe they were waiting to get vaccinated with their 12 to 15-year-old. Maybe they just need a little bit more, just a little nudge to go get vaccinated, or we're looking for a location that was more near to them, or maybe they wanted to get it from their primary care provider. So whatever that reason is, that next step, we're doing everything we can to get out there and make sure that we can, close that gap and get more people vaccinated.
And that's really the whole point behind the map, and looking at the map every week and seeing the percentage of people fully immunized or partially immunized, and making sure that we know in our minds and hearts that we've removed any access barriers to vaccination, and that we have worked within that community, whether that's the rural health community, as I talked about, with the Rural Health Association, with Purdue Extension, with Farm Bureau, or whether that's the minority population, the Latinx population, that we're working with community leaders who the community trusts, that have been vaccinated and can carry the same messages that we give here on a regular basis.
Next question is from Max Lewis of WSBT.
Hi, Dr. Box, Dr. Weaver. Thanks for taking my question. I have 2 of them. My first one is I was speaking with a local pediatrician today just regarding this 12 to 15-year-old. I wanted to know, what's the progress as far as getting the vaccines into local doctors' offices where, if people are coming in for a routine checkup or something, they can, get a vaccine. I've heard lots of doctors say they think that would be good as far as just because people trust their local doctors. So what's the progress on that?
So we agree with you 100%, and Dr. Weaver and our vaccine team have been working a lot on that, so I'm going to let her address that.
So we do already have some outpatient providers that are able to provide the vaccine. We're working to make it a more global thing so we can do that across the entire state. We did look to our hospital systems who have a lot of outpatient providers to ask them to start to solve that with their systems, and we're happy to hear that several already have. The process of even sending the Pfizer out to the local health departments, we are breaking down those very large shipments, which normally come with over 1,100 vaccines per shipment. We're breaking it down into smaller groups so that they can handle that smaller amount at all all the different local health departments. And we're going to learn some things through this process, and that'll help accelerate our process of getting out to more pediatricians and outpatient providers. We agree 100%. We know that they're looking at this at the federal level as well. How can we make this more manageable for our outpatient providers?
Great. And I was also wanting to ask, there, it seems like there's been a little more increasing national talk, at least, about the need to, or the, I guess, desire to get rid of masks indoors. I know Dr. Fauci had even mentioned that. Dr. Scott Gottlieb, who's a former FDA commissioner, has mentioned that as well. But, you know, it seems like our numbers don't necessarily point that way. So I wanted to see where you guys stand as far as masking indoors in particular.
So we just had this discussion before we came over here, and you know, I think that those of us that are fully immunized are very comfortable with going into a restaurant, sitting down with other fully immunized individuals and having a meal and not really being concerned. I mean, out of respect, especially when I'm in a county that has a mask mandate, I will put my mask on as I go to the restroom or come in or out, but I feel very comfortable, and the CDC has made it clear that you can have small groups of individuals together. Like I'll have individuals at my house for Memorial Day weekend, and everybody's going to be vaccinated, and we will not be masked. I do think that when you're still in very large groups, because there's still a significant percentage of people that have not had the opportunity or taken the opportunity yet to get vaccinated, it's probably wise to still have your mask on. But we are rapidly approaching that time where we should be able to open up being inside or outside without being masked.
Next up is Nikki Kelly of the Fort Wayne Journal-Gazette.
Hello, I have two quick questions. First of all, I know that you are not requiring school-age children to get the vaccine because it's under an EUA, but I wondered if you will do that when it receives full FDA approval, or would the legislature have to do that? And then I have a second question.
So the state of Indiana right now, Department of Health does not have any plans to mandate the vaccine for anyone.
And then the second question is, obviously, I wanted to know if the dashboard, when you add the children down to age 12, will you add them into the denominator? So I guess basically right now it shows 40% of eligible Hoosiers are fully vaxxed. Is that going to drop appreciably and kind of be like a little dagger in your heart?
Yeah, Nikki, great question. And we've had that same discussion. So we've asked the team to actually report both of the numbers so that for a while people can get used to the fact that, you know, this is our numbers of individuals 16 and above that are fully immunized, and, you know, and we add the younger kids in, this is the number.
Next question is from Kathy of the Ferdinand News.
Good afternoon.
Hey, Kathy.
How are you both today? I hope good.
Good.
Well, thank you.
I have two questions as well. I'm curious, I have never heard or read this, and I've kind of been waiting to see it. Are the variants, are people pretty well safe from the variants if they are fully vaccinated? Has that ever been determined, or?
So it's a great question, and we continue to look at that on a regular basis. The B117 variant does tend to be more transmissible and spread more easily, maybe more severe, put more people in the hospital, but we really do feel that our vaccines cover the B117 variant. As we see increasing variants, there will be more evaluation of individuals that are hospitalized. We're looking at everybody that gets hospitalized with COVID and actually sequencing their COVID-19 to determine if that's from a variant. And as we collect more data, not only here in the state of Indiana, but across the nation, we'll have more information about these other variants of concern.
Thanks, I wondered about that. And my other question, if Pfizer, or if they go ahead and approve Pfizer, the FDA, do you think they're going to start testing for children under 12? Is that in the works already? Or
Yeah.
I'm thinking my 8-year-old and down grandchildren right now.
Absolutely. Great question. And we actually got some good news a couple weeks ago that they might be reporting out some of that information in September. So we're hoping to be able to start vaccinating those potentially 2-year-olds to 11-year-olds sometime in the fall.
Next question is from Kayla Sullivan of Fox 59.
Hi, can you hear me?
Yes, ma'am.
Excellent. So some people might argue that 12 to 15-year-olds should be able to decide whether they want the vaccine for themselves? I noticed you said a parent or guardian must accompany the child. Why do you feel the parent or guardian needs to make that decision when it comes to 12 to 15-year-olds?
Because that's the law with regards to medical procedures and medications. You have to have a parent sign for that. So we can't do anything medically on a patient unless it's an emergency, true emergency, unless the parent or guardian signs for that. So we you know, I certainly believe that 15, 16, 17-year-olds should have input on getting a vaccine. I do believe, however, that is a parent's choice. And we are asking that the consent be signed by the parent or guardian and that an adult actually come with the child. So if mom or dad at work and that's a barrier to that child being immunized, they can bring the consent form in as long as there's an adult with them.
That's right.
Next question from Brandon Smith of Indiana Public Broadcasting.
Brandon?
It's Rob Burgess from the Wabash Plain Dealer, but
Oh.
good to talk to you.
All right, Rob. Good to have you.
Yeah,
Sorry about that.
That's okay. I've been called worse. This kind of goes back to the variance question. I know in the past you've said that yearly booster shots might be needed. Have you received any further guidance about this possibility, specifically as it relates to the variants? Because they seem to be fueling a lot of the recent uptick in cases here.
Just that it continues to be alluded to on conversations, on calls on a regular basis by General Perna and other individuals when they talk about we won't get single dose vials until the boosters come out in the fall and when they ship boosters. So we don't know anything for certain on that. I know that they're looking at whether we may need a booster for variants alone, whether they might mix a booster along with the flu shot, whether they potentially will just give this to the older age groups that may tend to have an immunity that wanes more quickly. So we don't really have any more information, Lindsay, unless you've heard something different.
I think that's all still being studied, and that they're going to learn more over the coming months, and hopefully we'll learn more too. And I know that for each of the vaccines that they're looking at this, whether or not a booster is going to be necessary.
Did you have another question, Rob?
Now we're going to go to Brandon Smith.
Afternoon, Dr. Box and Dr. Weaver. It's actually Brandon Smith this time.
All right, Brandon.
So you've talked already today and have been talking for a while about what you're doing to kind of counter any vaccine hesitancy that might still exist, as well as making sure that those access issues have been addressed, and you'll continue doing that. But at a certain point, has the government exhausted what it can do to try and convince people to get these vaccines?
I don't, here's what I'm going to say. I've been a healthcare professional for a long time, and I never became exhausted with telling my patients what would be in their best interest and having discussions with what would be in their best interest with regards to their health. And I had many, many discussions over many years with people about why I would like them to get a colonoscopy and what the barriers were to them getting that colonoscopy, or why I think it would be good for them to add exercise into their regular routine. So we really in healthcare don't get exhausted with it. I think we can't get frustrated with it, and we can't be judgmental about it. What we need to do is listen to people. Are they scared? Did they have a bad reaction or a bad result? Have they not known anybody that had an adverse effect or reaction to COVID-19? And then we just need to be able to engage in a conversation with them and make sure that maybe trusted individuals in their lives, whether that's another family member or someone in their congregation, an elected official they trust, someone at work, also has those discussions. So we'll continue to do this person by person, as Dr. Weaver said.
Yeah, I agree. I think that we will take all the allies that we can get. So anybody who is a influencer, whether they be an athlete or a singer or a local elected official, someone that leads in their community, maybe a leader in a family, right, that comes and calls all their family members and says, I need you to get vaccinated, that maybe that will come better coming from us. So whatever it takes. And so we'll continue to actually do outreach into those communities where we're seeing the lower uptake to help identify those people and then provide them with the resources they need to be able to talk about it. So we're actually working on a toolkit that we'll be providing to all providers across the entire state that have talking points and some of the data points that I talked about earlier, and links and information about the different vaccines, because we do know that we need all of our providers on board, and plus anybody else in the community who wants to be an ally in helping getting more Hoosiers vaccinated.
we all can be vaccine ambassadors.
That's
correct?
right. Yep.
Next question, Jenny.
Next question is from Whitney Downard of CNHI.
Good afternoon. I have two questions. My first question, I wanted to ask about if we had any update on breakthrough cases where we were seeing those, the populations that are impacted. And then secondly, I wanted to ask about the CMS requirement for nursing homes to report vaccine rates among their staffers and what your thoughts were on that, since the state did not choose to require that.
So I'll answer the second one, Lindsay, if you want to do the first one.
About the breakthrough cases. So we continue to see breakthrough cases, very, very small amounts. As I mentioned, 99.3% of our cases are from unvaccinated individuals. So you can do the math. That's only 0.7% of people who are vaccinated who actually get COVID. And we continue to see those in people who are older or immunocompromised, where they just don't get that immune reaction that we would have hoped that they get. So we'll continue to monitor it, but it still remains very, very small.
And Whitney, yes, I just learned of the actual CMS requirements for long-term care facilities, also some of our disability group homes and other homes to report the percentage of their staff and residents that are immunized. And we support that 100%. We think that is a great way for us to be able to know where we need to work and to focus further education, further support, go and have conversations one-on-one, as I was just discussing, so that we can help increase that percentage of individuals, especially the staff that are immunized.
Next question is from Justin at the Westville Indicator.
Good afternoon. What is the state doing to accelerate vaccine availability in rural and underserved areas? To that point, the closest clinic in my neck of the woods is about a 20-minute drive away. And if an underserved community wants to get a vaccine clinic, even if it's only a pop-up type opportunity, who should community leaders speak to help facilitate that?
So we are more than willing to put a pop-up clinic whenever, any time of day, any day of the week, especially in communities where that may not have one. So we're already doing that by looking at our numbers, doing outreach. That's where a lot of our mobile clinics already are going, and then working on our communication so that that community knows when we're going to be there. Dr. Box mentioned that we reached out working with Farm Bureau and Purdue Extension to help us identify locations and vaccine opportunities. So where do people in that community congregate in order to bring vaccine there, whether it be a county fair or some other event that we can make sure that we have vaccine.
Available.
Anything else? Right, yeah.
Yeah, I think it's just a question of if you know of a particular area that you feel has been ignored or that we need to address, just send it to Dr. Weaver or myself. We're at isdh.in.gov, and we will get our team on that. We'll look at the numbers specifically. We'll talk with your local elected officials and your public health officer and get something organized.
And I would add the local health departments as well. They can help make that connection. I know a lot of our local health departments are working on doing mobile units and have plans to go to the smaller communities within their county, especially starting, I think, in June as we're winding down the size of some of our mass vax locations. It'll make the opportunity to do that outreach more available.
Final question today comes from Dan Klein of Wish TV.
Thanks so much for taking my questions. Can you hear me?
Yes, sir.
Excellent. Two questions. One would be, you mentioned the ability to be inside without a mask. How soon do you think that could happen? And the other question, what would be your message for kids and parents who feel like the risk of severe illness for someone in that age group, specifically the 12 to 15-year-old age group, doesn't outweigh the risk of a child getting the vaccine? Thank you.
Well, I think that's a really good question, and I'm sure every parent and guardian will be kind of wrestling with that whole concept. You know, we've had over 2,500 deaths from children under the age of 18 from COVID-19. Our MIS-C cases that we referred to earlier are going up. But I think the more important reasons to get your child immunized is that if they do get exposed to COVID-19, they're not going to have to be quarantined. They don't have to miss school. They don't have to worry about not getting to do their athletic events. They don't have to worry about missing band or the show choir or whatever are the other things that they enjoy doing that has so severely disrupted their life this past year. Also, when children get vaccinated, it can help to protect other individuals in the household that can't be vaccinated, like our under 2-year-olds, our under 12-year-olds right now, and babies out there. So, Lindsay, do you want to add anything to that?
I mean, to the deaths, there's been 13,000 hospitalizations, which was more than the 2009-10 H1N1 flu.
Yeah, that's right.
So it's not that they haven't been affected; they really have. I mean, missing school. You were sharing the data that a large percentage, what was it, 11% of kids have the long.
Yeah, 11 to 15%, according to the NIH, have what they call kind of long-term COVID or long-term symptoms that continue after their acute infection.
Yeah, and we've seen kids in this age have the cardiac problems that we've seen come from COVID as well, and that takes them a long time to be able to recover and return to the things that they want to do. But I agree. I mean, to talk about my 15-year-old who's so excited about getting vaccinated tomorrow, she's had a quarantine twice this year, you know, missing 2 weeks of school, all the extracurricular activities that she wanted to do. It was really, really hard on her. It's been very hard on these kids that have had their lives upended. So I think that those are their motivations for going out and wanting to get vaccinated.
And as far as masks inside, I don't know that I can give you a specific date. I can just say that we're getting closer and closer to that date. I mean, I would hope to see that sometime early summertime.
That concludes today's health briefing. Thank you all for joining.